How was your reaction when you finally learned what was going on with your body?
Essentially, I did cry as soon as I left my appointment. It wasn't just like one feeling, it was this weird mix of relief and sadness all at once.
Hey everyone, welcome to another episode of Chronic Tea Podcast, and I'm the co-host, Kristen, and today I'm introducing the podcast because our host Tirzah will be the one answering the questions.
Today we're going to be talking about endometriosis. Actually, we're going to dive deep in it, and basically that sounds so weird that I said it that way, but we're going to dive into it and talk about it.
You know, I
I'm
didn't
so
think about
excited.
it until you mentioned it.
So let's get started.
So, can you take us back to when you first started experiencing your symptoms? Like, what were those early signs like? When did you realize that this might be more than just typical period pain?
Honestly, I feel like I've always had them. Like my very first menstrual cycle was literally around the day of Hurricane Katrina. Talk about doomsday, no joke.
Yeah.
So we were basically staying with my grandma for shelter, and I just remember that day I was feeling so sick and incredibly dizzy. The day after the hurricane passed, we basically returned home. And then so when I returned home, that's when I started my menstrual cycle for the first time. And it was scary, it was really confusing, and I honestly didn't really understand it too well. So I feel like as from there, things just kind of progressively didn't get better because I didn't start my menstrual cycle till the day before and I was already feeling dizzy and sick. So that's crazy. I was just a child. So
Yeah.
to experience that early on was crazy. So throughout my childhood and teens, my cycles were absolute hell. I had extreme pain that would make me cry and yell, heavy bleeding, literally scary heavy bleeding. I would get nauseous, headaches, back pain, and this deep, draining weakness. Not to mention, PMS that started 2 weeks before I even got my period. I felt so sick leading up to it, then even worse during. Eventually, I was actually put on the pill in high school, and it was at a really early age. And I'm not gonna
Yeah.
lie, it did help a little, but it was just pretty much a band aid at the time. And I didn't really question it. I thought this was just how periods worked. No one around me was talking about endometriosis. And my doctors, they just told me it was normal and handed me pain meds or another pack of birth control, essentially. I mean, back then, I don't think anybody really knew what endometriosis was. I never really heard about it either. So it's really crazy. And then on top of that, when ovulation happened, the pain just hit different. So, fast forward to adulthood, things got worse. That's when I started noticing these sharp, specific pains during ovulation. So, I brought it up to a new gyno that I was seeing, and he told me it was like a German word. I don't know what it's called, but I'll probably put it somewhere on the screen. It was called Mitchell Schreimers. I don't know. It's a hard word to pronounce, but it's essentially a German word which means middle pain. So we basically explained that, and some women get painful ovulations and some don't. And that was just that. But for me, it wasn't just like a twinge, it was intense and getting worse each month. And I kept wondering, is this normal? What is
Yeah.
happening? It was crazy. But still, my doctor at the time didn't want to explore it further. He said I was too young for laparoscopy, and once again, I was told just take birth control. Try having kids later. Maybe that'll help. So I just suffered for years, and eventually it just kept getting worse. And then around, I want to say probably around 2020 or 2021, things kind of took a turn for the worse. Essentially, I was diagnosed with gastroparesis because I couldn't eat without pain or feeling full fast. Then came recurring UTIs, bladder pain, and inflammation. I was being shuffled between specialists, put on rounds after rounds of antibiotics. My gut was wrecked. And then I got a kidney infection that turned into sepsis. It was really terrifying, actually. And nobody
Yeah,
could
that's a whole
explain
journey.
it. Yeah. After that, I saw an infectious disease specialist, and it was no help. I even went all the way to Houston to see a urologist, still no real answers. Nobody could explain it to me. It wasn't until I saw a functional doctor, the one that you recommended, that's when they're like, oh, endometriosis. Like, have you ever been tested for that? And I've never really, I guess, paid attention to it. So that's when like the moment everything just changed. So I started researching and suddenly all the pieces of my life started making sense. It explained the frequent UTIs, the frequency. I mean, I was going every 5 minutes, and the pain, the heavy menstrual cycles, like everything. It explained so much. So then PA at my urologist told me, like, you really need to get checked for endo. So I went back to my gyno, but this time it was a different one. Thankfully, a friend recommended, well, an acquaintance recommended me to her gynecologist and said she was really good. So I did tell her about all of this, and she did suspect endometriosis before. However, what doctors tend to do is they like to try like birth control pills first to see if it'll help. And if it doesn't, then they'll do like a laparoscopy to check. Or sometimes they'll do an ultrasound, MRIs, stuff like that. However, I only had an ultrasound and nothing really showed. So I was still
Mm.
dealing with this essentially. So it was a lot. I think it wasn't until I had sepsis and they're like, yeah, we really need to look further. So after that, I decided to essentially do the laparoscopy. Even my gynecologist agreed, let's do it. And yep, it turned out that I had stage 3 endometriosis. So
Mm.
essentially, the endometriosis was around my bladder and also the uterus. So I forgot where else it was wrapped around, but I know it was my bladder and uterus. And it showed like tightness too. And I even saw the photos. They were really gross.
Yeah.
Yeah.
Sounds
But
scary.
it was my surgeon basically removed what she could, and that's where I'm at now, like finally diagnosed, finally starting to understand my body and continuing this journey towards healing. So I guess I want to say is like if you think something or if you feel like your body is not normal or there's something going on, definitely check it because you never know. Especially if you're missing school or work or crying on the bathroom floor every month, it's not something you should just accept. Like, it's worth digging deeper. It could be very well endometriosis, it could be, or it could be something else. But either way, like, people deserve answers, you know? Like, it could take a long time to get an endometriosis diagnosis. I've
Yeah.
literally heard some people, it could take a decade or more. But yeah.
Yeah, and especially you were just suffering so much during the whole process. So it's
Mhm.
nice to know that you finally have an answer.
For sure. It definitely took a while.
Yeah. Well, that actually brings me to my next question. It can take a long time to get an endometriosis diagnosis, and I've heard that some people can take a decade or more, like you said. What was your diagnostic journey like? Were there moments of frustration or feeling dismissed?
Yeah, like you said, like sometimes it could take over a decade, which it really can, and for me, that was definitely the case too. Like I didn't officially get a diagnosis until adulthood, but I've been dealing with the symptoms since I was a literal child. Like that's a long time
Yeah.
to be in pain without real
Yeah.
answers. So what's wild is that the signs were always there: extreme period pain, heavy bleeding, fatigue, nausea, ovulation pain, bladder issues, but I was just constantly told it was just part of being a woman. I heard that line so
Yeah.
many times, it started to
Yeah.
feel like the truth. So I saw doctors who dismissed me, told me I was too young for endometriosis, or acted like I was exaggerating. And
Yeah.
yeah, and there were moments where I straight up felt like I was being unheard. Maybe it was all in my head. And when I brought it up, like things like my ovulation pain or how bad my periods were, it was always just stay on birth control or have you tried taking ibuprofen? Even when my symptoms escalated into GI problems, recurring UTIs, kidney infections, and eventually sepsis, no one really connected the dots. So I was like passed from specialist to specialist, put on antibiotics constantly, and made to feel like I was overreacting when I was just trying to survive. So yeah, there was definitely moments of frustration and like feeling completely dismissed. It was exhausting
Mm.
emotionally and physically. I knew something was wrong, but no one was really listening. So it honestly, I want to say it took me 14 years or so. And many women with endometriosis experience years of being told their pain was normal or even psychological. And
Yeah.
yeah, it was really hard too. Cause like, especially because they're like, oh, you have gastroparesis. And I was also struggling to eat. I would have pain. The food would come back up. It was just horrible. And I even redid that gastric emptying test. And This was like a few weeks after my laparoscopy procedure, and it turned out that I didn't even have like gastroparesis. Apparently, it was normal. So we kind of think it very well
Mm.
must have been the endometriosis causing the whole bladder stuff, the whole supposed gastroparesis, which is insane.
Yeah, for sure. And I know you talked about being told that the pain was normal and maybe even psychological. How did that impact you emotionally?
Oh, very well. I was unheard over the years. Doctors told me my pain was just part of being a woman, so that it was normal, you know? So I was just more, essentially, they would be like, I was just more sensitive to my cycle, especially through
Okay.
ovulation. One even implied that it would could be like stress or anxiety might be making things or, making me feel worse. So it was hard. Well, I mean,
Mm.
in general, it's really hard to explain what that kind of validation does to you. You start questioning your reality and you wonder, am I exaggerating? Am I being
Yeah.
dramatic? Yeah. Like, is this really just what every woman goes through and I'm just weak? But deep down, I knew what I was feeling wasn't normal.
Hmm.
I was in so much pain, the kind that kept me from functioning, from living normally. I missed out on
Yeah.
school, work, events, life because I was curled up in pain or feeling like my body was like falling apart. I even
Yeah.
remember, yeah, like I even remember being scared to speak up in appointments because I didn't want to be brushed off again. You kind of go
Hmm.
into survival mode. You
Hmm.
downplay your symptoms just so doctors will take you seriously. It's
Yeah.
yeah, it's like completely backwards, but when you've been dismissed so many times, you learn to play the game emotionally. It was draining. I literally felt so alone, and honestly, it made me delay seeking help at times because it just kept me feeling stuck. I think a part of me just gave up for a while, thinking this is just how life is for me, and that's the real damage of medical gaslighting. It doesn't just delay diagnosis, it eats away at your self worth, and it also teaches you to doubt your body instead of actually trusting it. But the moment I started being believed, when a provider finally listened and said, "You're right, let's check for endometriosis," it was like a light flipped on. I finally felt seen, and that changed everything.
Yeah, you need that validation, especially because you know, growing up, I was told too whenever I had a painful period, like, oh, okay, welcome to womanhood. Like other women would kind of like
Yeah.
laugh, like, oh, you're dealing with it too now, you know? And they
Mm-hmm.
would kind of just play it off. And I mean, I wasn't anywhere, I wasn't in as much pain as you were at all. So, but I get how people could just brush it off because they say pain is normal, you know?
Yeah, and there's a difference between cramping. Like, yes, some people have normal cramping, but it's not okay when it's excruciating and you're just
Yeah,
crawling in a ball, you're screaming. I can't even express all the times I've curled up
yeah.
to a ball, just, like rocking back and forth.
Yeah, because
you
what
know?
you've described is excessive. Like, I mean, I've had
Mm-hmm.
painful periods before. What woman hasn't, right? But it shouldn't get to the point that you cannot function, you know? And if
Yes.
it is to that point and it's consistent and it lasts for so long, then yeah, obviously something's wrong, you
Hmm.
know?
Of
So
course.
it makes sense. Also, what were some, like, because you talked about getting tested, what were some of the different tests or evaluations you underwent before finally receiving your diagnosis? Because I've read that other patients have to do, like ultrasounds, and even
Mm-hmm.
that's not sufficient sometimes for diagnosis.
Yeah, I did have an ultrasound, I want to say several times, but nothing was ever found. But the thing is, ultrasounds don't usually show endometriosis. However, in some cases, if people are lucky enough, it will. But for me, it just didn't. And that's because I was at stage three, essentially. So that's pretty bad. That's
No, yeah,
almost
that's bad.
yeah, that's almost close to four. So unless you have something else that's like going on, like a really large mass, then maybe it'll find it, but it's often invisible on scans. So some people say that MRIs can pick it up. However, in some cases that is true. They can sometimes catch deeper, infiltrating endo or spots in tricky areas, but still the
Yeah.
gold standard for diagnosis is a laparoscopy. So essentially, a laparoscopy is like a surgical procedure where they go in with a camera and actually look at what's going on. It's the only way to get a clear official diagnosis and even potentially remove some of the tissue during the same procedure. Endometriosis, though, is a really complex condition. It's not just about period pain, it can show up in all kinds of places throughout the body, which is unbelievable.
Yeah.
Like most people think of it like affecting the ovaries and uterus, but it can also be found on the bladder, bowels, kidneys, even the lungs, diaphragm, and in very rare cases, the brain or heart. Like, this thing doesn't play by any rules. You
Yeah,
know,
that's insane.
yeah, that's what makes the diagnosis so tricky. Like, you can have a million tests done and still be told nothing's wrong, when really it's just that the disease is hiding out of where the test can't reach. So, if you're out
Yeah.
there being told your scans are normal, but you know something's wrong, keep pushing. Your body is
Yeah.
telling you something, and you deserve to be heard. When I finally received that diagnosis, it was like a weight lifted, you know? But
Yeah.
the fact that ultrasounds just miss that is it's crazy. But yeah, the golden standard is definitely a laparoscopy.
So, I know you mentioned feeling, some relief whenever you finally got your diagnosis, but do you want to go a little more into that? How was your reaction when you finally learned what was going on with your body?
Essentially, I did cry as soon as I left like my appointment. It wasn't just like one feeling, it was this weird mix of relief and sadness all at once. So like on one hand, I felt like this huge weight lifted off my shoulders. Like, okay, I am not crazy. I'm not imagining this. There's a real name for what I've been going through. That validation meant everything after years of being dismissed. But at the same time, there was this deep sadness because endometriosis doesn't have a cure, you know? It's something I'll have to manage for the rest of my life. And even though I finally had answers, part of me grieved for all the years I suffered without knowing. And for the fact that this journey wasn't over, if anything, it was just beginning in a new way. So it's kind of like strange how getting a diagnosis can feel like a win and still break your heart a little. But that moment also gave me clarity and a sense of purpose. Like, I knew from that point on I'd fight differently, I'd advocate for myself harder, and I shared my story because nobody, should have to suffer in silence like that. You've already like yeah, like just essentially nobody should suffer. So I just want to say I had like a mixed like feeling about it.
Well, I'm just glad you finally got your diagnosis.
Hmm.
Let's just say that.
For
But
sure.
so you've actually already had some of your endometriosis surgically removed. Can you tell us about that experience? What led you to the decision to undergo the surgery, and what was it even like?
So, yeah, after the surgery, I'm gonna be totally honest, I actually almost didn't go through with it. I was terrified. So, everyone on online and the forums kept saying only do surgery with an endometriosis specialist, not just a regular gynecologist, and I agree. That is the best route. But the truth is, I didn't have access to one. Like, I was desperate. So, I had already dealt with so much pain, nonstop UTIs, bladder issues, and sepsis. Sepsis was actually my breaking point. That was like the last straw. So, I had been researching nonstop, losing sleep, trying to figure out what was wrong with me. And it felt like I was losing my mind. So, I finally told myself, what do I have to lose? Like,
Yeah.
I needed answers, so I did it. And as for the surgery, the day of the procedure, I was really scared. I mean, who wouldn't be? I remember getting prepped and they gave me something. I assume it was for anxiety. They're like, oh, we're gonna give you a happy pill. I don't know
That's
what
what they
it,
called it?
yeah. I don't know what it was, but they're like, I'm gonna give you a happy pill. And I was like, okay. And they just put it in my IV and literally it knocked me out so fast. So I don't remember after that, but all I know is when I woke up, though, that's when things got kind of extra scary. I was so pale, like ghost pale. Even the nurses commented on it. My blood pressure was super low. I basically, like, I wasn't actually panicking, but it was still scary. But I think it was probably because I still had the happy meds in my system.
Yeah, that makes sense.
Yeah, but it
Like with high
definitely
blood pressure.
for sure, but it definitely shook me a bit. Like, I think that's also why I was a little calm because of the meds that was still in my system, but it still kind of freaked me out that I was pale. But looking back on that, I actually think this had a lot to do with my POTS, which I didn't even know I had at the time. And I know we talked about this, like how anesthesia can make POTS symptoms way worse. So
Yeah.
that might have been what was going on. But
Yeah.
the hardest
And
part for
especially if they
me,
didn't know. right?
Yeah, like we all didn't even know. So that could be why like I was so pale, my blood pressure was low because we just didn't know that I had POTS during the time. But I definitely want to say though the hardest part for me wasn't even like the incisions or pain. The worst part was trying to go to the bathroom. Like nobody tells you about this. I didn't even know till I went through this. So nobody warned me that trying to go number one could be very painful and very hard.
I'm
Yeah, so
sorry.
every time I felt the urge, I physically could not go number one. It was extremely terrifying. Like my
Yeah,
bladder,
and that's dangerous.
yeah, it is. My bladder would fill up and it hurt so bad. I cried a lot. I was a baby. I have to admit that. It was really hard to walk. My boyfriend was with me the whole entire time. Thank God. And I was just an emotional mess. I kept blaming myself, like, why can't I do this? What's wrong with me? And during that moment, I was like, did they mess me up? Oh my gosh, I'm so scared. Like, I regret this. And even the nurse was like, no, no, it's not your fault. Sometimes this happens. It's just, for your case, it was a little worse. It was a little bad.
Yeah.
So, yeah, I eventually had to stay overnight in the hospital with the catheter because they wouldn't let me. They basically don't let you leave until you can go number one on your own, and it has to be like like a specific amount. They actually measure it in the bathroom. So I remember that next day, like I barely met the requirement to go home. It was still super hard to fully empty my bladder, but they let me go home since I could go at least a little bit on my own.
Yeah.
Um, yeah, but they had to like keep checking. Like they would use like a bladder scan. And so
Gosh.
even though I would go, like they would be like, "Oh, like halfway was clear from your bladder, but you still have some in there." So I think that was really scary, but like thankfully I was able
Yeah.
to go home. Yeah, and then as for the post-op, like the recovery was definitely hard. Like I had crazy shoulder pain. Like I'm gonna tell you that, like after surgery, your shoulders are gonna hurt because of the trapped gas they used during the procedure.
Oh, okay. I was gonna ask why
Yeah.
your shoulders of all things. You know, that just seems
Yeah,
so random.
because they essentially put like air. I don't really know how that works, but I guess like they put air or something like when you're going under or during the procedure. So like afterwards, you're gonna feel a lot of pain, just even pain in my chest. That's what I had. It was just like sharp pains and it was painful. And like I felt real sore, like on my shoulders, almost like I did a workout. Yeah, it was crazy. And then
That
like
is really crazy.
it is. And then going number two, like that was a whole different challenge. It felt like my insides were shifting. I was afraid to basically push everything because it felt weird and uncomfortable. Like I
Well,
tried to
yeah.
talk,
I would be afraid
yeah.
too because they literally just went in there.
And then you're pushing, so it feels uncomfortable. And I think my biggest fear was messing something up inside because I mean, they went in there and took things out. So it felt very weird.
Yeah.
But yeah, I tried to tough it out without taking meds. But you know me, like I don't like taking meds, I don't like taking pain medications. But I caved, so there was a couple times I did take ibuprofen. I'm just not a fan of of pain meds. But the pain was just too much, at some points. And
Yeah,
then
you needed it.
for sure. And also because I was worried about my gastritis. I was like, if I take ibuprofen, it's gonna mess up my stomach. So it's like, what else could I do at that point? So I took it because I couldn't take it. The other thing that I want to say was the lightheadedness. But this was just for me personally. I don't know if anybody's ever experienced feeling lightheaded, but it was pretty intense for me. But I think I'm pretty sure this was due to my POTS flaring from everything. Like my body had just gone through. So I essentially had to use one of those walkers with the seat to move around the
Yeah.
house.
I can understand that.
I want to say it took me a solid like 2 weeks before the pain started to ease up, but honestly, I still felt off for maybe about 3 months after. Like slowly though, I started to feel more like myself again. But yeah, it was just really tough. It wasn't an easy decision, that's for sure. And yeah, it definitely wasn't an easy recover, but honestly, I don't really regret doing it. I mean, I kind of do, but there's some points on why I kind of regret it. But at the same time, I don't because that surgery gave me answers and it confirmed what I've been fighting to prove for years. So I was
Yeah.
diagnosed with stage three and they found it around the bladder, the uterus. So my doctor was able to remove what she could, and just knowing that it was real made all the pain, all the doubt, and all the gaslighting, like it just made it feel
Yeah.
so much more worth it.
Yeah, and
Mm-hmm.
I'm personally glad you did it because just knowing how much it had already covered, and if you hadn't, how much further would it have spread? You know, it could have been dangerous.
Mm-hmm. And that's also another thing. I feel as if maybe if the doctors had done this earlier, it wouldn't have been at a stage 3. It wouldn't have gotten
Yeah,
this bad. Yeah, and I wouldn't be having like these frequent UTIs and the bladder inflammation and then going through sepsis too. That was really hard. So I feel like
yeah.
I should have done this early, but I guess I don't know.
Yeah, and if they had just caught it earlier too and then given you the recommendations and stuff too, it would have been a lot different for sure.
Mm-hmm.
But actually, on the topic of surgery, there's different surgical approaches like excision and ablation. What method was used on you, and what would you recommend for others, who are undergoing the same option of getting surgery?
So when it comes to endometriosis surgery, there are a couple of different approaches. Like there's, of course, like you said, excision and ablation. And here's the thing, they're not the same, and the method used really does matter. Like in my case, my surgery was actually a mix of both. My gynecologist did an excision, so which means she cut out the endometriosis lesions, but she also mentioned that she burned some of it, which is ablation. And I remember thinking, no, because I had read so many times that ablation isn't the best option. And the reason why it's not ideal is because ablation is when like they burn the surface of the endo lesions and it might help temporarily, but it doesn't remove the root of the disease. Like endo grows beneath the surface, so burning the top layer can actually leave the deeper tissue behind so that pain comes back. Sometimes even worse. Plus, ablation can cause scarring, which makes future surgeries harder and increases the risk of complications. So, that's why excision surgery is considered the gold standard for endometriosis. With excision, they cut the disease out completely, which gives you a better chance of long term relief and can reduce recurrence. It's more precise and a way and basically way more effective when it's done right. Now, ideally, you want to have excision done by an endometriosis specialist, someone who does this all the time and truly understands how endo behaves in the body. Gynecologists mean well, don't get me wrong, but unless they specialize in endo, they may not have the training to find and remove it all, especially if it's in tricky areas like the bladder, bowels, or diaphragm. But listen, I get it. Not everybody can afford to see an endo specialist because I couldn't. So I had no other choice but to go with a gynecologist. So if you're in that position, my advice is do your research. Ask what kind of surgery they do and make sure they use excision, not just ablation. Like, look
Yeah.
into their background too and how much experience they actually have with endometriosis, not just routine gynecologists, because your care does matter and your body matters. And you deserve a doctor who knows what they're doing, because it is super duper important to not do the whole burning
Yeah.
thing. So, definitely.
Yeah, especially if one option is better than the other, like that, it's good that people at least know. You're actually going to be facing another surgery to remove the rest of it. You had only gotten some of it out. So what are your hopes and concerns going into this next procedure?
Actually, so right now, like I'm not 100% sure if I'll be able to have another surgery to remove the rest of my endometriosis. Do I hope I can? Absolutely. I would
Okay.
love the chance to get more of it removed and possibly get even more relief, but the reality is it's complicated. Like finding a true endometriosis specialist is already hard. There just aren't enough of them, and most of the time they're out of the network with insurance. That's what's holding me back the most right now. And here's something a lot of people don't know: insurance usually doesn't cover excision. I mean, sometimes it does. I mean, it did cover with my gynecologist, but with surgery with an endo specialist, I've noticed that it's completely different. Like, even though it's a golden standard, like the reason why it's because like many of these specialists don't work within hospital systems or traditional insurance networks. They're often out of network providers because they want to treat patients without being restricted by insurance rules that don't prioritize complex chronic conditions like endo. And also because I did remember reading up that sometimes insurances don't really basically pay those specialists to do such a complicated like thing.
Hmm.
So that's the thing. So it's really frustrating because like endo is a real disease and it deserves specialized care, but the healthcare system doesn't treat it
Yeah.
that way, you know? Like instead we're left fighting insurance, jumping through hoops, and often having to pay like thousands out of pocket if you want proper care. So, yeah, I'm kind of like in a weird place of hoping I can do another surgery, but also knowing the financial, emotional, and just all those hurdles that come with it. It's not fair, really, and it's also not okay. But essentially, I'm just trying not to give up. I'm still researching, still weighing my options, and still trying to figure out how to make it work because I know my
Mhm.
body deserves better. And like, if
Yeah.
you're, yeah, it really does. And I can't believe it's at a point where it's just that complicated, to get that kind of help. But all I could say is if you're listening and you're in the same boat, you're not alone. Keep advocating, keep pushing. You deserve care that actually helps you heal.
Yeah, and I honestly can't believe that it's not covered more under insurance, especially because it's an actual pretty debilitating condition.
It
Like,
definitely
and it can be
is.
can get really dangerous, wrapping around your heart or other vital organs. So
It can
yeah,
also cause like organ damage, which I don't want to like scare
like
people,
organ
but it
failure.
does. Organ failure, organ damage. It's
Wow.
crazy.
Yeah, no,
hmm
that's really crazy, and that's something that should be just more well known in general.
It's it should be like really prioritized too, but sadly it isn't. I don't think insurance see it as like a necessary thing, especially when it comes to pelvic floor therapy, which I think I do talk about that. I mean, I think I will talk about
Hmm.
that.
Yeah, and
hmm
that's messed up. They're just like, oh no, your organ health isn't necessary. Is basically what they're saying. It's crazy.
100%.
Yeah. And so, now that you've gone through the process of the surgery at least once, what does your recovery process look like so far? Since, especially because this is the first time you've ever done it and it's a new experience, are you in any pain?
I'm still in pain, sadly, especially during my monthly cycles. In some ways, though, the pain actually feels a little worse since the procedure. I'm not saying that to scare anyone, but just to be real, because the truth is, like, endo is complicated.
Yeah.
Surgery isn't always a quick fix, especially if not all of the disease was removed. And in my case, not everything was removed, only some of it was. And also in my case, there was a mix of excision and ablation. If you have that and it's not, if it wasn't done correctly and not done by a true endometriosis specialist, then you're still going to feel that kind of pain. So that's why I always recommend if you can try to see an endo specialist for your surgery. They know what to look for, how to remove it properly, and also how to navigate cases where endo is hiding in harder to reach places like the bladder, of course, the bowels, or the diaphragm. Your regular gynecologist may mean well, but they don't always have the advanced training that endo
Mhm.
specialist really requires. So essentially, I'm still figuring out what my next steps are, and I'm just trying to manage the best I can with what I've got. But I know more than ever that the right surgeon will make a huge difference.
Yeah, I'm sorry about that.
Mm-hmm.
I'm glad that you're still pushing through and, you're making the best of it that you can. And I'm glad you even got it in the first place because, um,
Mm-hmm.
I mean, from what I've heard, what you told me, they took out a lot. So that's
Yeah.
good. That's good.
Mm-hmm.
And, what type of treatments or therapies have you been using to manage any ongoing symptoms or pain that you're still dealing with right now?
So, when it comes to managing my endometriosis and my symptoms, I am not on anything at the moment. And I feel kind of lost in that area because, like, I've tried different treatments in the past. I've been on like three different birth control pills, one combination pill, and two progesterone only type of brands. And none of them actually worked for me. Like, in fact, they made me feel worse. Like, I kept feeling really lightheaded, and my blood pressure would drop even more than usual. And I have POTS, so I truly think the hormones were making those symptoms flare up, like the dizziness, the weird fatigue, the way my
Yeah,
heart would
the blood
react.
pressure for sure.
Yeah, and I would feel like I would want to pass out. And then when I tried the combination pill, well, I felt like it messed up my mental health like really bad. I want to say it really did mess with my depression because there are things that I would think about that wasn't actually me or something that, I would do. So I just felt I was like, no, I need to get off of it. So and essentially I just felt so off and it just didn't feel safe or sustainable for me. Birth control is often the first thing doctors push for endo, but the truth is it doesn't actually work for everyone, especially not for those of us juggling multiple chronic conditions. So I've also looked into things like pelvic floor therapy, which I've heard can be super helpful for managing pain and the tension that comes with endo, but get this though, insurance won't cover it, which I know we did talk about last time, I think in the very first podcast. But essentially, insurances don't see it as a medically necessary type of thing, which is wild because so many people with endo and chronic pelvic pain actually benefit from it.
Mm-hmm.
A doctor can essentially try to file a claim for it, but only if they're willing to basically do that extra step. And even then, like, insurance has told me that it's not guaranteed to be approved, which is also crazy. So that's essentially another wall I've hit while just trying to feel better. So right now I'm kind of like in limbo. I'm not on meds. I'm not in a therapy program. I'm just trying to figure out my next step, like what's safe and what won't make it worse, essentially, and what I can access with the support I have. And it's simply unfair, living with chronic pain and a condition like endometriosis can take a significant toll on mental health. So yeah, it's definitely tough.
Yeah, I think it's crazy that they're not covering those therapies. That would be really helpful, you
Mm-hmm.
know. Well, what other, treatments or medications have you tried that have been effective? Because I know you mentioned birth
Mm-hmm.
controls not being effective and stuff like that.
So far, I haven't really found anything. I've tried like medication from our functional doctor, and for some reason, when I take it, it just makes me like shortness of breath. I think it was called like Vitex progesterone. I tried that because he said that some of his patients would take that for endo and they helped them, but for some reason, I would just get like short of breath. But I do want to go back and retry it again and see like try it again and be like maybe it's just anxiety or something. Cause
Maybe. The
yeah,
shortness of breath makes me wonder if it, like, does it cause anxiety or something, you
mhm,
know? I mean,
I
it
don't
could cause
know.
anxiety.
I just know anything like messing with your hormones can be really sensitive, and I'm a sensitive person when it
Yeah.
comes to medication, but at the moment, like, I'm not on anything. So I think this is something that I'm gonna discuss with my gynecologist soon, and not only that,
Yeah.
but I also have to talk to my doctor for POTS because it's like a whole team of doctors. Like, I have to manage my POTS, but essentially also try other things to manage the pain and the heavy, menstrual cycles. I'm even thinking about getting an IUD, but I'm really scared. I don't know. I don't want to get like an infection from it or something.
I'm hoping that your POTS is maybe more of like something that's happening because of your endo. So maybe hopefully the symptoms will lessen the more you treat your endo. And that's what I'm hoping at least, because I know that with my GBS, my POTS symptoms have really decreased, you know? After getting more of the treatment and just having my nerves kind of back, I do notice I feel a bit more steady with that. So I'm hoping for you too, that
Thank you.
maybe the endo is just aggravating it or something, you know?
Yeah, maybe.
Well, hopefully, right? That'd be nice.
Hopefully, it would be.
Yeah. And then, so shifting into more of like the emotional or mental impact, living with chronic pain and a condition like endometriosis can really take a big toll on mental health. Can you share some of the emotional challenges you faced throughout your journey with this?
I want to say that, yeah, it really does take a huge toll on my mental health. And I just don't think it really does get talked about enough because, first off, just knowing there's no cure is incredibly isolating. It's
Yeah.
emotionally heavy to wake up every day and live with something that may never go away. And I don't say that to scare anyone, but to be real, there are days where that thought alone just breaks me down. And what's even scarier is endo isn't just like bad periods. Like it could lead to organ damage, like we discussed, even organ failure in some cases, and still is treated like it's not a big deal, which
Yeah, that's
blows my
insane.
mind. Yeah, and it blows my mind that we're in 2025 and yet insurance companies and even many doctors don't treat endo with the urgency or seriousness it deserves. So, yeah, like emotionally, it's also hard knowing that I don't have access to an endometriosis specialist where I live in the RGV. Like, I can't even explain how frustrating it is to walk into an appointment with valid, important questions and have doctors straight up tell me I'm not really sure or that's not
Hmm.
something I know much about. So it makes me
Yeah.
wonder, like, are they just not learning enough about endo in med school? Are they not reading updated studies or keeping up with research? Like, why does it still feel like endo is some medical mystery no one wants to solve? And why are,
But
yeah.
oh no, I was just gonna say it's really weird that you need a whole endo specialist. Like, why don't gynecologists know more about this, right? Because even with my condition, I went to like a neurologist who's, they specialize in general neurology stuff. It's not just one condition. I didn't go to like a GBS specialist, you know? So you would
Yeah.
think that the gynecologist would know more. It's just insane.
Yeah, it is. It's because from what I've learned is gynecologists focuses on a mixture of everything. Like they focus on like the whole childbirth, and like all these other things that they don't have time to focus and learn about endometriosis because to be an endometriosis specialist, I guess you have to focus on that one condition because it's super complex. So a lot goes
Okay.
into it, like you gotta learn about it, like even people say it's like almost as similar to like an autoimmune condition essentially because it's like super inflammatory. It does cause inflammation. So
Yeah, and
since
it
it's
spreads.
yeah, and it spreads. So since it's so complicated, I don't think gynecologists have time to actually sit down and go in depth with this. So that's why endometriosis, like, well, the specialists, they do that and like they constantly study on it. So I think that's probably why I'm just assuming,
Mm-hmm.
but yeah, like I just feel
That
like
makes sense.
yeah, but it shouldn't still be a medical mystery that no one wants to solve. I don't know. And then patients are basically left doing all the research and asking all the questions, and then we're basically having to become our own doctors. So it's emotionally exhausting, and then it makes us feel, I guess, like helpless, unheard, and
Hmm.
honestly kind of angry because like
Yeah.
yeah, I'm tired of being brushed off or tired of hearing that's normal when my body is clearly screaming that it's not. And like, it's essentially just tiring, like living in pain without the support or resources. I should have access to that. Like, other people should have access to that. But at the same time, I still try to push through it because, like, I know my body and I know what I'm feeling is real. And even when the healthcare system fails us, we still show up for ourselves and for each other. I think that's what's really hard. And I also want to say one of like another parts that gets me emotional is like the possibility of not being able to have kids. I'll never forget the time I sat down with a psychiatrist and she looked at me so seriously and said, like, how does it make you feel knowing that you may not be able to have children? Because
Yeah.
endometriosis can affect fertility. And like, can you actually sit there and just like, or can you actually imagine someone just saying that to your face like that? I've always felt kind of undecided about having kids, but hearing it like that kind of hit hard and hit me different because what if one day I do want that? Or like, what if I change my mind and it's too late?
Yeah.
Like, it's something that sits with you, something that you just always carry. And I know it's not impossible. Like, I know people, I've heard stories, I've seen it on forums where people that have endo were able to have children, but it definitely was a lot harder and it took time for them. So I feel like that
Yeah.
uncertainty, like the uncertainty of it all is just like very emotionally heavy?
For sure.
Yeah, like there's a grief in the possibility of losing a future you haven't even decided on yet. And I think that's something we don't ever talk about enough either.
No, that makes sense because even with GBS, if you have a kid, it's a very high chance of relapsing. So imagine like having a child and then just going through all the paralysis again. It's insane, because it's like you just became a mom and then you have someone that depends on you and then you can't. You're just there stuck in bed or something. So
Yeah,
I understand. It's a really big decision because it
that's
can really
really hard.
impact you.
Mm-hmm. For sure.
When, speaking on that topic, others with endometriosis do say that it's affected their relationships. So, how has endometriosis affected your relationships with friends, family, your partner?
When it comes to how endometriosis has affected my relationship, I say that I've been really lucky. I haven't really had major issues with my relationships. Like my relationship with my boyfriend has been very supportive. However, with like friendships, yeah, it depends. Cause like with you, you've been super supportive. I've had friends that have been really understanding. They're like, I know if you're ill, we can always reschedule, hanging out some other day. And I truly appreciate that. I think only one time I did have an issue with one friend or who supposedly was my friend, and they were upset with me because I wouldn't go, to their events. Like I wouldn't show up because I was like ill. This was before I even knew I had endo. So I think that was really tough for me because instead of communicating and talking to me about it, they would just, I guess, throw shade at me through like a group messaging thing. I think I did tell you about this. This was like part of the high school reunion thing, and she was literally throwing shade at me, and her excuse was because I wouldn't show up to her events, and she knew that I had chronic illness issues, and I just think that wasn't fair. So I want to say that that time it really did impact me, but I kind of understood that she wasn't a true friend, But
Yeah,
however,
some people can be selfish.
but thankfully I've been lucky with some friends and relationships, and like I know that's not the case for everyone. So I'm super grateful that like for the support system I do have, especially like I said, my boyfriend, like he's been incredibly understanding through all of this. Like even when things get really hard, like having someone like that in your corner makes a huge difference. But that doesn't mean like it doesn't mean that it hasn't been challenging. I mean, sometimes I've been called lazy, and this goes towards like family. I think that's one of the hardest things to hear because like I'm just not lazy, and being told that is hurtful
You're one of
because
the most hardworking like people that I know ever.
thank
So
you.
you're very hardworking. You're not lazy.
Yeah, like, because I'm not just tired, If I'm asleep, I'll hear that, oh, you're so lazy. Like, I wish I could be as lazy as you. And it's like, I don't have a choice to lay down. I'm living with endometriosis and POTS, and those two conditions together create like a level of fatigue that's hard to explain. Unless you lived it, it's not just being sleepy or low energy. Like, your body physically shuts down, and when someone calls you lazy for that, it kind of stings. It's frustrating because I want to do all the things. I want to hang out, show up, and be productive, be present, but sometimes my body just doesn't let me, and people don't always see that side of chronic illness. So they don't really see the flare days, like the bathroom breakdowns or the post surgery recovery or the hours spent curled up with a heating pad. They don't really see all of that. But despite all of
Yeah.
that, like I've learned that people who really care, they'll try to understand, they'll listen when you explain, and they'll love you anyway, even on your worst days. So yeah, I want to say endo and chronic illness have changed the way like I show up in relationships, but they've also shown me like who's really there for me, and for that, like I'm truly grateful.
It's good to find positives for sure. So
Hmm.
I'm glad that you're seeing like the positive side too, because I know a lot of people can focus on negatives, and that's never healthy if you just focus on the negatives.
I'm actually grateful because I've gone through therapy. I've been in therapy for about 2 or 3 years, and I really do want to say that it's helped. It's helped me think of things in a more positive way than focusing on the negative because before I wasn't like this. I wasn't really confident in myself or positive. I was essentially just really negative. It was so hard. Even the first year when I was in therapy, there was a point where I had to write down certain things, I guess, that I was going through. And then my therapist would be like, "Can you try to find something positive out of this aspect?" And it would be so hard because I couldn't think of nothing. But after doing this exercise continually, I feel like it's helped a ton.
I'm glad. I'm glad it's helping you. And going back to your diagnosis, a lot of women feel a sense of relief after they've finally gotten, an explanation for their pain. Did you experience this when you got diagnosed with endometriosis? Like, how has it changed your outlook on your symptoms and your relationship with your body?
I feel like I have a sense of relief, because I know what's wrong with me. I'm not crazy. I wasn't being dramatic. I had a name for everything. I essentially, I just had a name for everything that I've been dealing with for years. So that alone made me feel validated and seen in ways like I haven't before. But at the same time, it did change my relationship with my body essentially. I feel like I started becoming a lot more cautious and intentional with how I take care of myself. Like, I realized that endo isn't just like a period problem, like, it's a full body disease. So it can affect your immune system, your gut, your bladder, your energy, literally everything. So I tried to shift my focus to more of like an anti-inflammatory kind of lifestyle. I have to admit though, I'm far from being perfect, but I do try to eat foods that support healing, like less
It's
sugar,
hard.
less. Yeah, it's really hard because don't get me wrong. Sometimes I want like ice cream. I mean, I'm lactose intolerant, but I have like a little dairy free kind of like ice cream, or sometimes I'm eating chips. It's hard to get me away from chips, but I try to stay away from like less sugar, less processed stuff, and essentially more things that help reduce inflammation. I've also had to be more mindful about managing stress, which is really hard for me, and this. Like
Yeah.
if I yeah, like stress makes endo worse. So you don't want to do that. But that's a real challenge for me essentially. Yeah, especially like it's kind of hard not to be stressed when you're in pain or constantly dealing with medical stuff. So yeah, the diagnosis essentially, brought relief, but it also brought a deeper level of awareness. So now I kind of understand that I have to work with my body and not fight against it. So I'm still kind of learning and just listening to it, nurture it, and just try to create a life that also supports healing. So even when that healing is ongoing, like endometriosis can impact like daily activities. So I'm still trying my best, but it's not easy.
Yeah. Yeah, I mean, endometriosis definitely can impact your daily activities. How has it affected your ability to pursue your goals and live your life?
I want to say it definitely has affected that because when it comes to like pursuing my goals, one of the things that I really want to do is go back to school. I want to go study for cosmetology and also create my own business and do people's makeup for prom or weddings. But it's really hard. And people often say, "Well, why not do online?" And yeah, I probably could do online school, but the thing is, I'm always tired. And I don't mean like just needing a nap tired. I mean deep bone crushing fatigue from dealing with
Yeah.
endometriosis and POTS at the same time. So even when I'm doing something I love, like streaming, which is honestly one of my favorite outlets, it can be hard to show up some days. I push through though when I can, but sometimes when I finish stream and I'm completely drained, I'm just like, no, I gotta lay down because I get really tired. There's even times on stream I'm like yawning so much. Even my managers, you kind of gotta improve your energy. And I'm like, I'm sorry, I'm always just so tired. So I really do say it's super noticeable. I mean, my manager noticed it with my live streams. So yeah, it's so, like, trying to imagine adding school on top of that, it just feels overwhelming right now. That doesn't mean I'm not giving up on it, but it does mean I'm learning how to work with my body. But there are definitely moments where I wonder if I'll be able to reach that kind of success I want.
Yeah.
But I'm still trying to believe in myself. I know it's not impossible. I mean, I've seen you go through that. You've become successful, you were able to graduate. So if you can do it, like, I can do it too. It's
Yeah.
possible. But I just think it just might take a little bit more time, and like a different approach and a lot more self compassion. So, yeah,
Hmm.
chronic illness has kind of shifted the way I move through the world, but I'm still trying to move forward, at my own pace in my own ways.
Yeah, and time management I think is the biggest thing because sometimes I see your streams and I'm just like, how is this girl still going? How is she how is she still have energy? How is she like you'll stream for so long and then I'm just like, wow, I'm amazed.
It's
So it
hard.
might just be management. Like, so if you really do want to go to school, maybe just like limit yourself to only 2 hours or something, like a solid 2 hours, so you could have time to do other stuff. Because, yeah,
Hmm.
school's definitely going to take up a lot of your time, and it's good that you set these limits, like now, and get used to it before, I don't know, before you just burn yourself out.
It is completely hard though because even when I do streaming, I still gotta film makeup content. So essentially, that within itself is also hard. And then I'll have brand collaborations and then I have like certain due dates. So that's what makes it a little difficult because I'm like, oh, I have all these things, but then I feel tired. So that's also what makes it super hard.
Yeah.
Hmm.
Yeah, and I guess if I were you, I would focus on like the brand collaborations and push those first, especially
Hmm.
if you want to go to school. Just focus on the stuff that you absolutely have to do, and then yeah.
For
But
sure.
yeah, it's definitely difficult, and you're
Hmm.
very ambitious.
Yeah, like
Um,
I do agree with that because I know the time when I started my whole cycle, I was in pain, endometriosis flare, and you're like, oh, like I'll let you rest. I didn't even rest. I was focused on the podcast. I was curled up, but still editing, and then I got it done and posted it on the same day we finished it.
Yeah, and see, like, there's a lot of times whenever I'll talk to you and you just sound like like you're dead, like you need a rest. And I'm like, okay, yeah, I'll just let you rest. But then, yeah, like you said, you just go and work more.
It's
So,
so
yeah,
bad. I
I
have an
don't know if I'm
addiction.
doing you a favor or not.
I just have like an addiction. I'm such a workaholic, I suppose.
Yeah. Now I'm starting to like question. It's like, should I keep her on the phone longer so she can relax?
Probably, yeah.
Okay, good to know. And moving on, like with the going back to endometriosis, like it can be a big financial burden. Have what are some of the economic impacts that come with managing that? Like, especially because it's a chronic illness.
Oh,
So,
yeah. It's definitely expensive, especially food wise, because I'm trying to go for more like a cleaner diet and anti inflammatory. And then, of course, the supplements that our
yeah.
doctor does or gives us, it's really expensive. Like, it's so
Yeah, I was just
pricey.
looking at one of them today because I need to get another one, and I'm just like,
I know, I was doing the same thing because there's two that I need, and I'm just like, And then he still wants me to do like the mold toxicity test, and I'm just like, oof, that's a lot of money. Like, I don't know,
yeah.
you know.
And mold toxicity isn't covered by anything, as far as I
Yeah,
know.
for sure. But
Yeah.
yeah, it's really expensive. Like, it's not just the medication or surgeries, like, it's everything in between. For example, talked about pelvic floor therapy to help manage my pain. Well, essentially, while it can really benefit me, it's so expensive. We're talking like $150 per session. I've literally called them an ass, and that adds up fast.
Mm,
Yeah, especially
that's
when
crazy.
insurance, yeah, and then insurance won't cover it because like they don't consider it like medically necessary. So then there's that issue of seeing an endometriosis specialist. We live in the RGB and unfortunately we don't have any true endo specialists in this area. So if I want to see someone who really understands this disease, I have to actually travel. So that means gas or flights, hotels, taking time off, and all the other
Mhm.
expenses that comes with that. And that's before you even pay for the specialists themselves. Like a lot of endo specialists, of course, we said they're out of network. So insurance isn't going to cover them all. So that means paying thousands of dollars out of pocket. So yeah, like managing endo isn't just like physically and emotionally exhausting. It can be financially draining too. And like that adds another layer of stress, especially when you're already dealing with pain and fatigue. It's like, how are we supposed to focus on healing when you're constantly worrying about how to afford the care we need? I know I'm not the
Yeah.
only one dealing with this, essentially.
Yeah, of course. I'm just sorry it's
Mhm.
been such a burden.
Yeah, and I honestly think it's time we start calling it what it is, like a healthcare access issue.
For
That's what it
sure.
is. People with chronic illness shouldn't have to choose between financial stability and getting real treatment. Like, we deserve better than that.
Yeah, of course. Of course, because you can't just put all your money into getting better and then you have no money to actually live.
Yeah,
It's
and
pretty
groceries are
crazy.
expensive nowadays. So,
Oh, they're only getting higher. So, yeah.
but yeah.
And going into, a little bit more advocacy and awareness surrounding your endometriosis and POTS issues, have you experienced any medical gaslighting from doctors? And, if you have, elaborate a bit on it. Like, how did they make you feel? And what advice would you give to others who are dealing with it?
Oh, 100%. I experience a lot of like medical gaslighting, like more times than I can count. There's so many appointments where I walked in explaining my pain, my symptoms, how much it was affecting my life, and I was just like brushed off. Like doctors would just say like, "Oh, you're too young," or "You're just unlucky." That's just part of being a woman, or it's probably just anxiety or scent, or like your scans look fine, your labs look fine. There's nothing wrong. I even had a cardiologist straight up told me it's just anxiety. You need to get over it and move on with your life. That was really hurtful. And I was just like,
Yeah.
okay, like nothing is solved. I remember leaving some of those appointments feeling so defeated. Maybe I was really being dramatic or overthinking things. That's what I was thinking. But deep down, I knew what I was feeling wasn't normal. So it was very heartbreaking, hearing all those things because I'm not being believed. Essentially, I'm being unheard.
Mhm.
So essentially, when you're in pain and people with medical authority make you feel like it's all in your head, it basically chips away at your self trust. Like it makes you second guess your body and your voice, even your worth. And it kind of, in a way, makes you feel insane. So My biggest advice for anyone going through that is don't stop at the first no. If something feels wrong in your body, keep pushing. Get a second opinion, or even a third, a fourth if you have to. I know it's frustrating, and honestly, it gets exhausting having to explain yourself over and over again, but the right provider will listen and they'll take you seriously. It also helps to bring a symptom journal or notes to appointments. Like, be specific and be clear, and don't be afraid to advocate for yourself because no one knows your body better than you do. And at the end of the day, you deserve to be heard and you deserve answers. And you absolutely deserve a doctor who respects and believes you, especially because you're the one paying for it, and it's a lot of money. So you
Yeah.
want to make sure you get what it's worth. So what motivated me to like do that is just basically everything I went through, Like, I remember I would just be like, oh, I feel so and so, but I wouldn't really have notes on like how I'd feel. So I kind of feel like they would just brush me off. So I would definitely say take notes, you know.
Yeah. Yeah. And would you say it's these experiences that you just mentioned that motivated you to become an advocate for endometriosis awareness?
For sure. This one's super easy for me because what motivated me to become an advocate for endometriosis, it's really simple because I didn't want anyone else to struggle alone the way I did. Like yes, don't get me wrong, like I had support, from my boyfriend, he's been amazing, and of course like my friends like you've been there for me through it all. But even with like that support, I still felt so alone at times, not just emotionally, but in a sense that no one, including myself, could figure out what was wrong with me. I
Yeah.
didn't
You were just
know.
isolated.
Yeah, like I didn't know why I was getting UTIs constantly, why I was in pain, or why my body felt like it was falling apart. It got to a point where I honestly thought, what's the point of living every day? And I hate to admit that, but that's how I felt during that time. And I think that was extremely hard, just waking up every day and just being like, what's the point of living if I'm feeling this way, if I'm in pain and no one can actually help me, no one is hearing me. And I think that's when I was in a completely dark place. And I never ever want anyone else to feel that way, especially not because of a condition like endometriosis that's so, underdiagnosed and misunderstood. Like, another big reason I advocate is because in the RGV, like, we don't have any endo specialists. That alone makes everything harder. So I felt like if I'm going to live with this, then I'm going to speak up about it. And I want to educate others and raise awareness and maybe help someone else get answers faster than I did. So that way they don't have to wait like 14 years and then more
Yeah.
damage is, being like, basically happening. So the hardest part though is definitely feeling like some doctors don't take it seriously and they don't always know about endo, or they don't seem to stay up to date with new studies, new treatments, or even just how complex this disease really is. And I don't get it, I don't have a medical degree. Like, I know that. I only know what I know because of my lived experience. But sometimes it feels like doctors aren't willing to listen unless you've got credentials to back it up. But still, I believe lived experiences does matter because we're the ones surviving this every day. We're the ones who know our bodies best. And that's why I keep speaking up, because if I can be a voice for someone who's still in the dark and still waiting for answers or feeling like they're losing hope, then it's totally like worth it in a sense, you know?
Yeah, for sure. So, there's a general consensus that more research and funding is needed for endometriosis. In your experience, what are some of the biggest gaps in understanding and treating this disease?
Okay, there are like many gaps in how this disease is understood and treated. Like,
You're
sorry.
like, where do I start?
Yeah, like, woo, there's so much. But yeah, even like by medical professionals. So, like, one big misconception is that the idea that birth control is a solution. However, don't get me wrong, some people find relief from it, and I'm not knocking what works for others, but in my experience, and for a lot of others like I've spoken to, birth control is just like a band-aid. So it might help with pain temporarily or make your cycle lighter, but it doesn't treat the root of the problem. It doesn't stop the disease from progressing either. It's often the first and only option we're given. Another major gap is in what causes endo in the first place is a lot of doctors still talk about the retrograde menstruation theory. So essentially, the idea, I mean, the retrograde menstruation theory means it is the idea that like period blood flows like backwards through the fallopian tubes and implants in the pelvis. But that doesn't explain why people who don't have menstrual cycles anymore, or even some who've never had a uterus, still develop endo. So it's kind of outdated essentially.
Yeah.
Yeah. And that's what my gynecologist told me. Like it's a backflow. But honestly, there's way more to it because I actually read a book called Heal Endo by Katie Edmonds. It's a really great resource, not sponsored or anything. I literally just bought the book out of my own money and I just generally recommend it to anyone struggling with endo. And honestly, I think even gynecologists should be reading this book because in it, she explains that some people may actually be born with endometriosis. It could be related to dysfunction or
Yeah.
inflammation, genetics, so many different factors. That's why we need more funding and research and updated education, not just for patients, but for doctors too, because this disease is so much more complex than just bad periods. It's a chronic inflammatory condition that affects the entire body. And until we start treating it that way, people are going to keep basically falling through the cracks. So if there's one thing I want to see change in my lifetime, it's that we finally start treating endo like it's serious essentially, and it's essentially a systemic disease. Not just with pain pills and birth control, but with real research. That's what we need. Real answers and real care.
Yeah. Yeah, definitely. What kind of changes do you think are needed in the healthcare industry in particular and society to better support individuals with endometriosis?
I honestly have a whole list. First and foremost, we do need better education for doctors. Like endometriosis should not be something medical professionals barely touch on in school. There needs to be an in-depth training on how to recognize it, how to properly treat it, and how to listen to patients who are clearly in distress. Too many people are dismissed for years because their symptoms basically don't show up on an ultrasound or because their pain doesn't fit into a neat little box. Second, we need access to specialists. Not everyone has an endo specialist in their area. I mean, I don't. We live in
Yeah.
an area like here in the RGB, we don't have those resources, and that's basically unacceptable. People shouldn't have to travel hours away or pay out of pocket just to be seen by someone who actually understands their disease. And this just goes beyond endometriosis. Like, any type of specialist because sometimes with specific illnesses there's just not enough doctors and you have to wait months in advance,
Hmm.
so it's really difficult. So in general, I just feel like we need more of these specialists, and insurance companies also need to step up. Like pelvic floor therapy, they're often not covered or are labeled as not medically necessary, so that needs to change. Like, managing a chronic illness should never be a luxury. And on a bigger scale, like I think society needs to start believing people with invisible illness. Just because we look okay on the outside doesn't mean we're not struggling. We need to move past the
Hmm.
idea that pain is something people just have to deal with, or that it's normal for menstrual cycles to be unbearable, because it's not. And finally, we need more awareness, more research, and more empathy. Like, people with endo deserve to be heard, understood, and properly cared for. Like, we deserve answers and we deserve options and we deserve to live full, joyful lives, not just surviving from one flare up to the next. So, yeah, there's a lot that needs to change, but I truly believe that by sharing our stories and raising our voices and continuing to push for better, we can actually make a difference. And I'm not going to stop until we do.
Yeah, that's really awesome. And going back to like the specialist thing, even for my condition, which is like, nervous system related, there's only like one or two who could do it and who are even covered by insurance. So it's definitely a struggle. I
Agreed.
really do hope that changes.
That's also why it goes more like into than just endometriosis. There's more people suffering and there's not a lot of specialists, and we really do need that. Like, there needs to be a huge change.
For sure. And for those who are listening who might be experiencing similar symptoms, what are some of the steps that you would like recommend them to take to get a diagnosis and or advocate for their own health?
Well, if you're listening to this and some of my story sounds familiar, if you're dealing with painful cycles, fatigue, bladder issues, GI problems, or just feeling like something's not right in your body, I just want to say you're not alone and you're not imagining it. Here are a few steps I do recommend if you're trying to get a diagnosis or advocate for your health. Like, First and foremost, track your symptoms. Like we said, keep a journal, digital or paper, of everything, like your pain levels, fatigue, digestive issues, cycle patterns, ovulation symptoms, flare triggers. Even download apps. I know there's like certain apps, I would use them to help track it. And it was really helpful. This gives you like a clear picture over time and something concrete to bring to your doctor. And the other thing is, don't stop at one doctor. Like, if you feel dismissed, ignored, or not taken seriously, get a second opinion or even a third or a fourth, because, that's super important. Like, don't ever stop
Yeah.
with just one no. And I know it's exhausting, but sometimes it takes basically seeing multiple providers before someone actually listens and connects the dots. And the other thing is, ask specific questions. Bring a list. I'm
Lists
sorry.
are important.
Lists are important. Bring a list into your appointments. Ask about endometriosis directly and ask if they also treated endo before. Ask what kind of surgery they do, excision or ablation. If surgery is recommended, you definitely deserve answers. So definitely ask those questions. It's always important whether they do excision or ablation if the surgery is recommended. So always ask them. You deserve clear answers. And the most important thing too is do your own research, but cautiously. Books like Heal Endo by Katie Edmonds is a great resource because it basically follows reputable endo advocates and educators online. With not, basically knowledge is power. But
Yeah.
also, don't let Google overwhelm you. Use it to guide your questions, not scare you off, because I've done that before. I've
Dr.
been
Google.
Yeah, I've been down the rabbit hole, use Dr. Google to scare me off, and it shouldn't be that way. It should help you with questions. But the other thing is definitely like lean on support too. Whether it's a friend, partner, or even a support group, having someone in your corner makes a huge difference. Because I can't explain to you how like alone I felt, but having my best friend and also forums did make a huge difference, including my boyfriend. I was really glad that I had that support. Especially because my friend would always make me snap out of it. Like, Kristen, you would always make me snap out of it. I'd be like, am I going crazy? Or the doctor said this. And she'd be like, no, like, that's probably something that you
I,
really are feeling.
I
you
would
know?
research for you too.
Yes, we would both research. But yeah, I've definitely had amazing support from my boyfriend and a few close friends, and essentially, I'm just beyond grateful for that. So you don't have to go through this alone. So know your worth. The healthcare system might not always be on your side, but you are your biggest advocate. Don't let anyone tell you your pain isn't real. Like, keep speaking up even when it's hard. You know your body better than anyone, and I know I say that 1,000 times, but yes, you do know your body anywhere. So, getting a diagnosis definitely isn't easy or manageable. This condition is a journey, but you're allowed to take up space and you're also allowed to ask questions and you're allowed to demand better care.
For sure. I mean, looking back on your journey, what are some of the biggest lessons that you've learned about yourself and your resilience?
Um, I mean, I've been getting like dismissed by doctors, like living in pain and like all my illnesses for years.
Forever,
Yeah, forever
basically.
essentially. And like not having access to specialists, going through surgery, managing POTS on top of it all, But one thing is clear though, I know that I am stronger than I thought and I'm more capable than I ever gave myself credit for. So like I feel like this journey has definitely tested me physically, emotionally, and mentally. So there are moments where like I truly didn't know how I was gonna keep going. And then there is also moments where I felt invisible or like my body had betrayed me. And I think that was also the most hardest thing, because it really felt like that. Like my body was betraying me and it shouldn't be doing this to me. And I just thought it was unfair. But, I'm still here and I'm still fighting, still speaking up, still learning how to live with this illness while holding on to hope. Especially considering like I went through sepsis and all, and I'm still trying to stay strong. So I've learned that advocating for myself is also hard, but it's also necessary. I've learned how to listen to my body, how to say no when I need rest, and how to ask for help even when I don't want to, because that was like the biggest issue that I had. I
Yeah.
never really liked asking for help, but I'm starting to learn how to do that because I learned that it's okay to ask for help. But I always just like felt like, no, I could do it by myself kind of thing. But no, it's okay to ask for help. And I've also learned that, like I'm not alone and neither are you. So if you're listening and you're in the middle of your own health battle, like whether it's endo or something else, I just want you to know you are resilient, you are powerful, and you are not weak for having bad days. And you are so much more than your diagnosis. This condition doesn't define me at all, but it has helped me discover my strength that I essentially didn't know I had. And I think that's something that I'll carry with me always.
That's really beautiful. I mean, on that note, has living with endometriosis changed your perspective on life, health, or your priorities?
Yeah, most definitely. I've been through a lot, like I said, emotionally, physically, and also spiritually, because I had sepsis from a kidney infection caused by the recurring UTIs I was dealing with, which were most likely tied to my endo. So, in all
Sounds like it.
honesty, yeah, like I could have lost my life during that time, or I could have lost limbs or organs, everything, but I didn't, and I'm still here, and that means something. I am a strong believer in God, and I truly believe He kept me here for a reason. I don't fully know what that reason is yet, but I trust that there's a purpose in all of this. Like, maybe it's to share my story, maybe it's to advocate for others, maybe it's just to remind someone else out there that they're not alone. Whatever the reason is, I'm forever grateful. I'm grateful to be alive, grateful for every breath, essentially, every day, every small win. Like, this journey has taught me not to take anything for granted, and not my health. Don't ever take your health for granted. Not my time, not the people who love and support me. Endometriosis has made me reevaluate everything. I've had to slow down and shift my priorities and start honoring my body in ways I never did before. So that's completely different because I'm like a workaholic. So I'm always having to like shift my priorities, and it's not always easy, but it's made me more present, more intentional, and in a weird way, more alive. So yeah.
Yeah, that's really good, though. I'm glad you're feeling the positives. And so, what are your hopes for the future, both for your own health and for the broader endometriosis or chronically ill community?
When I think about the future, both for myself and for the endometriosis and chronically ill community, my biggest hope is that maybe, like just maybe, a medical professional will hear this podcast, especially someone from the RGV. I hope they find it by accident, I don't know, and they see it and something will click. Like, I hope they're out, like, I basically hope they'll stop and really ask themselves, like, am I doing enough? Am I listening to my patients? Have I stayed open to new information and research? Because the truth is, things need to change. And not just for me, but for all of us down here. Because when I scroll through RGV forums, I see post after post from people who know the care here isn't great. And so many talk about having to leave the RGV just to get proper treatment. I even knew an acquaintance that had to go to Houston because I think he needed a heart transplant, which is insane. So,
Having to
that,
travel so far is crazy.
yeah, and that shouldn't be the norm. Like, we shouldn't have to travel miles away, drain our savings, or risk our lives because local access is broken. But, the part that really hurts is that it literally feels like we're just accepting it. Like, we're used to settling, and I don't want that for us anymore. I want people to realize that things won't change unless we speak up, and we can fight for better care. We do have a voice, and here are just a few ways you can start, such as share your story. Like, whether it's on social media, in a support group, or with friends, your experience matters. Someone out there needs to hear it. Second thing is we can always speak up at your appointments, ask questions, challenge dismissive attitudes, bring notes. You're allowed to advocate for yourself. Thirdly, we can also support others in the community, like uplift each other, share resources, go to local health events, join or create support groups, be the connection someone else needs. And then, of course, contact local representatives, like advocate for funding, research, and better healthcare policies for the RGB. Call, email, show up. Your voice matters more than you think. And also encourage better education. Ask your providers if they're open to learning more recommended books, articles, or even podcasts like this one. Like, go ahead and share them this podcast if you need to. Like, change starts with awareness. So yes, my hope is for healing for myself, for all of us, but My bigger hope is also for a systemic change. I want better care and I want specialists in the RGV. Like, I want doctors who are informed, compassionate, and willing to grow. And I want us to stop settling because we do deserve better.
Yeah, and I definitely agree with that. So, what message would you want to share with others who are newly diagnosed with endometriosis to help them feel less alone?
If you've just been diagnosed with endometriosis, first take a deep breath. I know it's really hard because it was hard for me. I was like panicking. I know it probably feels overwhelming and confusing and even scary because I was there too. I was really scared, like, oh my gosh, what am I going to do? Because there's no cure for it essentially. And it's just going to progress. And I think that was really scary. But I definitely think that it's good to just take a deep breath because you might be asking yourself, like, what now? What does this mean for my future? Will I ever feel better? I mean, essentially, those were questions that I was thinking. And if you're in the same boat, like, I just want you to know that you are not alone. This journey is definitely hard. Like, there's no sugarcoating it. There will be good days and also bad days and moments of frustration and moments of strength you didn't even know you had. But through it all, like, I want you to remember this, that your pain is definitely real and your story does matter. And you are also allowed to take up space in the medical world, even when it feels like it wasn't built for us. So it's okay to grieve and it's also okay to be angry, but don't lose hope. Find your people, whether it's online in a support group or just one person who gets it. And also educate yourself, ask questions, be curious, and be bold. And most of all, be gentle with yourself. This isn't your fault. I've been there before where I actually blamed myself. Like, I thought I was broken, that it was my fault. Like, how could I have something like this? But understand that it isn't your fault and you don't have to prove your pain to anyone.
Yeah, that's really beautiful. And if you feel comfortable diving a little bit deeper into this subject, how has your experience with endometriosis affected your partner, family, and other relationships? Like anything else you want to add to that? And how have you navigated that yourself with your partner and with others?
Honestly, it hasn't really been like affected or anything. I just feel like I just have like a really huge support system with that. So I'm really grateful for that. And it's also been helpful because I feel like they're learning as I go with this situation too. And I love it. Like, my boyfriend's literally the sweetest. Like, there's times where he knows that I have a habit of overdoing it. So when he's at work, he calls me and he's like, don't worry about the clothes or don't worry about the dishes. I'll wash them when I get home. Just finish your content. Like, he's real supportive of my content and streaming, which I truly appreciate. So he's like, if I find out that you overdid it, I am going to be upset because you need to rest. And he knows how I am. I'm always on
Yeah.
the go and I try to push myself hard, but I know that I can't do that. So I really do want to say that he's just very supportive in that aspect.
Oh,
Mm-hmm.
that's very sweet. I'm
Mm-hmm.
glad you have a good support system and that you're feeling like you're not alone and that you've got this. And and I feel like things have really been turning around for you, especially now that you've been validated, number one, and
Yes.
then like by medical professionals, and that you've actually had a surgery, and that you might even have another one in the future to finish taking everything out, which is
Mm-hmm.
pretty amazing.
Yeah, it really is. I think that's all we had for today.
Yeah, that's all we have for today.
All
So
right.
thank you everybody for listening, and I hope that if you feel like you resonate with anything that has been said here, don't be shy. You can reach out, and I hope everything goes well for you if you're dealing with anything like this.
Yes, feel free to like comment down below because you are not alone in any of this. It is definitely a complex disease. Not many people understand. It is really difficult, but you're not alone dealing with this. But yeah, that is all that we have for today. It was a long podcast. I apologize. But there's just so much things to like go into because it's not just like one thing. There's like so many things that go into this. So it's a lot, but hopefully it'll help spread awareness with this condition. And yeah, thank you guys so much for watching. Until then, see you all next time. Bye.